So anal stenosis. Anal stenosis is a condition where the anal canal becomes narrow. Most commonly we see the anal stenosis after anal surgery. Most commonly what I see in clinical practice is after open hemorrhoidectomy. A conventional open hemorrhoidectomy wherein all the three hemorrhoidal masses are excised. So especially when the patient has large hemorrhoids and there is excessive removal of the skin of the anal canal, especially when they are swollen, at that time when the surgeon does the surgery, the chance of having anal stenosis is very high. So normally the surgeon doesn't leave a bridge of skin between these hemorrhoidal masses, then the scarring is going to be bad and the patient will develop anal stenosis. So anal stenosis is a very annoying problem. The patients have a lot of symptoms, they are not able to pass stools, sometimes they have loose stools because they take a lot of laxatives, a lot of burning in that area, they find it very difficult to pass stools, and this can become a very annoying symptom. Recently I had a patient who had got removed all the external hemorrhoids and he had got severe anal stenosis, and the anal orifice was like a pinhole, something like a pinhole anal orifice. This patient stopped eating food and he lost weight because he's having fear of passing motion. He's not able to pass motion at all. So this could be as bad as that. Anal stenosis is a very preventable problem. It can be prevented by a very judicious surgery in the anal region. Not only hemorrhoidectomy, any anal surgery can cause anal stenosis. Most commonly what we see is after an anal surgery. Sometimes infections can cause anal stenosis. Laser surgery can cause anal stenosis. So all these things are very well known. So one has to be very judicious and very thoughtful when they do these surgeries. Anal stenosis, how do we manage anal stenosis? So it depends on how bad the anal stenosis is. Some patients have very mild anal stenosis, some patients have little moderate kind of anal stenosis, some patients have very tight anal stenosis. When the tip of the finger cannot be passed. And some patients are very short or very like a membranous anal stenosis, which is very easy to treat. Very short anal stenosis, just it's have to break the membrane. So some patients have very lengthy anal stenosis. These are the difficult ones to treat. Patients who have very mild anal stenosis, very short anal stenosis are very easy to treat. These patients require only examination under anesthesia and anal dilatation, and after that the patient has to do self-dilatation using St. Mark's dilators. The patient has to be taught how to do the anal dilatation, and that is enough for most of these patients. For some patients who don't respond to this, simple internal anal sphincterotomy may suffice. This is going to widen the anal orifice and they are able to pass stools normally. Even these patients should be advised to do anal dilatation. Patients who are having very long anal stenosis and tight anal stenosis, these are the patients who are going to benefit from anoplasty. A plastic surgical procedure